Hi everyone, I'm Dr. Georgine Nanos. I am a family physician and the CEO of Kind Health Group. I also have advanced expertise in epidemiology, which is the study of how diseases are spread, and public health. This is Annie Clark, who's our Director of Health and Wellness and one of our head health coaches here. And we recognize that there's a lot of public concern, fear, panic out there. And so we wanted to reach out to everyone and provide valuable, credible medical information to help people get through what is going to be a rather unusual time for us in our national identity here. So we want to take questions from people, and we want to provide up-to-the-minute information. I'm in touch with a lot of the local public health authorities. I've been speaking about coronavirus for the last couple of weeks on national and local media outlets. So we want to make sure that everyone has good information and that they feel safe and calm and reassured in the best way we can possibly do that. So, Annie, you want to shoot some typical questions at me?
So we get a lot of questions. What's the best advice that you can recommend for people right now who are worried?
Stay calm. It's going to be okay. This is definitely, seeing a lot of large events like schools and big public events and businesses closing is certainly contributing to a lot of widespread panic, which is understandable. But right now, what you need to do is take a breath and know that we are going to come out on the other side of this okay. If you're a healthy individual and you're practicing good common sense hygiene and sanitary practices, washing your hands all the time and using hand sanitizer. If you don't have sanitizer, it's just the best thing is still to wash your hands with plain old soap and water for 20 to 30 seconds, sing a little song, do a little happy dance, and then you're good to go. You also want to disinfect your phones as often as possible.
Very important.
Yeah, we often forget that. Our phones are way dirtier than our hands. And you do want to practice some social distancing. Don't shake people's hands right now. Don't do hugging and kissing. And really just try to use some common sense and create some space so that you're at lower risk. If you are not feeling well, do what you would normally do if you feel like you have a cold or flu-like symptoms. If you're a very sick person and you tend to get sick in those situations, then you should call your physician and figure out the next steps. If you're having extreme respiratory distress, meaning like you can't breathe, then you would want to take measures there. In those emergent situations, then you can go to the ER. But if you're just feeling crappy, stay home. And this is what we would say all the time anyway. We've been saying this forever in medicine. So
you don't need to rush out and get testing from your doctor? Do you want to talk a little bit about testing?
Yes. So this is the COVID-19 test. It's nothing all that special. It's just a new medium here. But there are not enough tests out there for everybody. So I have some and I'm getting more, but I'm not going to have thousands to screen thousands of individuals. We're not going to have that infrastructure in place for probably a few more weeks. And so in medicine, we have to think about why we're doing a test and what is it going to change in terms of our treatment protocols. And so if I do this test, and if you come to me and you're not feeling well and you say you want a coronavirus test, I'll do the test, but it's not going to change anything. I'm still going to tell you to isolate yourself, and I'm still going to tell you to use supportive care measures at home, rest, fluids, fever reducers, that kind of thing. And if we don't have a treatment or a vaccine, then what's the point of the test? So I don't think people should get all bent out of shape about not being able to get a test right now. Yes, in a perfect world, it'd be great if we could test everybody and know, who are those asymptomatic carriers, people that may not necessarily show the symptoms, but maybe transmitting it. That's definitely a concern that's out there, but we have to be realistic. It's just not possible right now. And we want to make sure we're not overwhelming our healthcare system at this point in time with unnecessary visits. So the other thing too is, people are worried about all these closures happening prematurely and that it's causing mass hysteria. Yes, certainly I'm concerned about the public panic in that regard, but we also want to consider that, people are, there are people who will be affected by it, people who are older and have pre-existing medical conditions such as heart disease or diabetes, lung disease, kidney disease, other diseases that make them immunocompromised. And that's a big concern for those people and those elderly individuals as well who might be affected. So one of the things in public health and in epidemiology is containment. And so closing and limiting the spread is a standard protocol of containment. And it's going to be very uncomfortable for us. It's going to be very disruptive to our lives, but it's doing it earlier is going to prevent more problems down the road and prevent us from having a longer period of containment in, say if we waited, for a couple months to start closing stuff down, then the disease is very far widespread and the healthcare system is going to be much more overwhelmed. It's already overwhelmed now. It's overwhelmed every day. So
your advice would be to wash your hands as often as possible, use hand sanitizer, clean your phones. If you haven't had a flu shot, get a flu shot.
Absolutely get a flu shot. We have flu season going on through May of this year. There's still flu shots available. Couple reasons to get a flu shot. If you get the flu, you're going to be more susceptible to getting COVID-19 because your body is going to be your lungs are going to be struggling and trying to fight that infection. It's much easier to get a secondary infection like COVID-19 in those situations. So you do want to get the flu shot, and that'll help reduce the spread of the flu as well, which is going to may complicate things at this time. And if you have had the flu shot, it'll also help healthcare workers determine what exactly may be going on with you.
And if you've had a fever or a cough for several days, stay home.
Stay home.
And remain calm.
Remain calm. And then, one of the silver linings in this is that we're going to have to slow our lives down a whole lot. And so that is, in some ways you have to look at it as a gift. It's a time to get reconnected with your family and do stuff that you've always wanted to do around the house. And what are you going to do, Annie?
A lot of cooking,
scrapbooking,
reading,
photo albums.
So
downtime,
a lot of downtime.
A lot of downtime, and just try to be grateful for all that we have and realize that we're going to come through this on the other side. The majority of us are going to be just fine, and you do need to remain calm and present that aura of calm for yourself and for your children and your family. I think it's really important because anxiety creates other issues. So we want to continue to do that, and we're here to do that as well.
And we're going to update you. We're going to update again and give out more information as it comes in. So remain calm.
Yes. Okay. And we have also, we added some new services. Do you want to talk about those, the health coaching? So one of the big things that we focus on here at Kind Health Group is prevention. And so in order to meet the very big demand right now for stress management, immunity boosting, and I think
and eating well. You sort of don't want to bunker in and just eat cookies the whole time. You really want to remain healthy.
Right. So we want to provide that role and allow people to find a space where they can continue to stay healthy, to eat well, to exercise outside if you can, to do all the things that would keep your immunity up, and also keep your sanity intact.
Our program is here, and we're available to talk. We can talk online, talk by phone, sort of, check in and be there.
Virtual visits, we do telemedicine visits, we do regular family practice when we can do it all remotely. So we are here for our patients. I want them to all know that, and we are taking new patients for a limited time, depending on how many we get. So So that's it for today. And if you have, please follow our YouTube channel, and we're going to be putting this out on a podcast that you can also subscribe to. And you can check out our website for updates as well. And if you have questions, please send them in. We'd love to answer them. Thanks a lot, everybody.
Thank you. Remain calm.